the really big improvement of the patient is done when the patient is followed from different departments at the same time. So in this hospital as well, what we see is that like all the physical treatment is going in a very good way when the patient is also support emotionally. So it can be by counseling, can be by psychological care, depending on the need of the patient individually. But what I really want to underline is that sometimes is really the daily routine activities that give the patient the big improvement for his motivation and for his staying in the hospital. So for sure you can understand that although all these people is very, very resilient, so they know how to manage, they have a lot of they find by themselves different solutions in their life how to deal with these terrible situations, and they teach us also as human beings, we are the first learning from our patients. But at the same time, it's so complicated for them. Our work here in the hospital is also very difficult to effort. Why? Because for us, we know that we treat them, we help them to feel better, to go through the surgery, to decrease their traumatic symptoms. But at the same time, when they finish their medical care here, they have to go back to this very difficult context. So sometimes when we see the same patient coming back from the second stage of surgery, the third stage of surgery, we see that some of these symptoms increase again. Something also we are trying to increase the quality now is the self-care for the staff. Because working in this hospital for everyone, not only for the mental health staff, is also for the nurses, for the doctors, for each one involved here in the medical care and in the support care as well, is to give also them some kind of support to be able to come here every day and work with the patients. The group activities we do in our department, because every afternoon for male, for female and for children, we have every day a different group activities, because it's very important for them to socialize as well in group. And it can be art, it can be movies, it can be music, it can be handicraft for women, it can be drawing, it can be many things, free play for the children also. So they really remember this kind of activities, and when they go back to this difficult context, they keep this remembering with them. So I had some patients coming and saying, okay, I was back in Yemen, but I was still remembering our time together in the hospital. So if you think this from a logical point of view, it sounds very strange, because you think how you were thinking, how your nice stay to the hospital. Nobody likes to stay in an hospital. Or also the same happen with this, especially with children. Sometimes we have children living in the refugees camps. And so they do their surgical treatment here, then they go back to the refugees camp in Jordan, and after a while they are back to the second or third or fourth stage of surgery, and they stay another long time in the hospital. So they try to come back as soon as possible to the hospital. They come here and they really change their life. They can walk again. We have patients who were not walking since 5-6 years, and after they are here 8, 9, 10 months, you see them walking again. So imagine our emotions when we see the first time a patient.
Since the Palestinian thing, then the Iraqi, then the Kuwaiti, then the Syrian, so it's always like we're having a lot of refugees. So there's a lot of NGOs are working here in Jordan, trying to help those refugees. But we are talking about medically and giving operations, surgical solutions for those patients. I think we are the only NGO who's doing that. Working with MSF, it always gives you a chance to be like in direct contact with the people who are in need in general. uh, working with war victims is it's really complicated, and there are people who are coming from countries that they are really messed up, and there is a lot of war. They're seeing a lot of things. They're seeing their families murdered. They are seeing themselves like injured and having no one to take care of them. We have a lot of patients that are here without a caretaker, without a family even. So to feel that and to see those on a daily basis, it's really stressful. But what make us feel relieved at the end, that at the end of the day we are working like seeing like 15, 20 patients a day and try to improve something in their life. And as I said, as a physio, we are trying to improve the quality of life for them. Your achievement when you see the patient, he start to back to his normal situation physically, and he start to ambulate and he start to take care of himself. So this will give us a big relief, and will give us a feeling that we are doing something for the humanity in terms of being able to help those people who are really in need. Our big challenge in this area that our hospital is really here limited. Like we would like to have similar projects like more than one reconstructive surgery, not only one, because there is a lot of injured people from Iraq and Syria and Yemen, and they are with millions.
Many waiting list.
We have long waiting list, and we are trying to keep it up with the needs by opening hospitals in the home country. But the beauty of the project here in Jordan, that we are working mostly with the complicated cases, with cold cases that it's been like since years they are suffering from an explosion or a gunshot or from a torture. So those patients, they are in thousands and thousands, and they are getting increased day and day due to the complex situation in the Middle East. So this is our big challenge for now, and we try to accommodate all of them, and we hope that we can be able to reach more and more of those patients.